and welcome to our JTECH Medical webinar on employer services and our upcoming seminar in Salt Lake City on April 12th through the 14th. My name is Mary Fairhurst, and I'm going to be your hostess today. On with us we have Carol Jamrose, who's our instructor of our seminar, and we have a special guest, Mary Meyer, and you'll hear more about Mary Meyer coming up. So if you're having any technical difficulties, please use the chat at the bottom of your screen. Should be on the bottom left-hand side. Make sure you send the chat to me, and I will reply to you by chat. That is how you're going to let us know if you have a technical difficulty, and that's how you're going to ask questions as well. So if you think of something, you can go ahead and send it when you're thinking about it, and then we will take questions and answer them at the end. Okay, so we're going to need to get started. We are missing a few people who are getting in late, but hopefully they will catch up and they will be able to also hear this recorded session online when it's posted to the JTECH website. So again, welcome, and I'm going to start out by introducing you to our presentation today. Employer Services, the Marketplace Needs You is the title of our April seminar here in Salt Lake City. And the idea behind the webinar today is to show you why you should attend and to tell you a little bit more than we have in our materials as to what's in this for you. Why this seminar? So why the JTECH seminar, and what makes our seminar different from others on the market? Most seminars on the market are from clinician to clinician, and they teach you how to perform the actual tests, and basically that's only one component of getting into the market. And getting into the market really requires that you know how to market to employers if you're a clinic, and for employers it really means that you need to know as an employer who's out there that can service your account. And the seminar that we provide is unique because it is taught by a skilled, well-experienced employer. That would be Carol. And Carol is actively partnering with clinics for the benefit of both the clinic and the employer. So I'm going to turn it over to Carol now and let Carol take it from here.
Good morning, and thank you for letting me share some of this information with you. My background is in engineering, and I have been working for RGL since 1999. When I was brought on, my main focus was reducing injuries. The company could not get traditional workers' comp insurance because the safety risk was so poor. We had typically 100 employees on deck at any certain time. We were paying $1.5 million for workers' comp. And through the processes that we've put in place and partnering, we've been able to add 200 employees, so we're up to 300 employees, and our workers' comp insurance now is down to about $424,000 a year. So you can see that I have had lots of success, and it's mainly due to the partnering with a clinic. We had a long history of not having a very safe program, even though we had a safety department, but it was expected that you would get hurt as part of the job. So part of what we had to do was change that it's not expected, and that was both on the worker side and the management side. We're now considered a good risk, and at any given week I will get a phone call from an insurance carrier asking me if I'd be interested in changing my workers' comp insurance. So my background is in engineering. I have quality, manufacturers, systems, and human factors engineering, and it leads me to think a little bit different about safety and injury prevention. I think about it the same as preventing a machine from going down. Kind of takes the human out of it, but it has been very effective in helping us understand how do we prevent the injuries. So one of the tools that we used was partnering with a local health clinic. And We started out with drug testing and DOT physicals, injury assessment, and we've added so many services now that we'll get to later. But as a package, our employees believe that they are well taken care of, and so it has really helped improve our safety culture. One of the things that you'll learn, or there's many things that you'll learn, but one of them when you come to the seminar in April is the employer side of workers' compensation. What is it that employers need to do? How do they document it? What do they have to report to OSHA? How do they have to count the days and the hours? And how is the mod rating calculated? How is the documentation presented, and what is private, what isn't? And how partnering with a clinic can help understand those numbers, and employees can come back to work and we can reduce the cost immediately, affecting our injury costs, our hiring costs, our insurance costs. And once a provider can help accompanied with that, you've got a pretty solid base for a partnership. So how will the seminar help my clinic or business make more money? There is so much healthcare reform out there that we don't know for sure where that's going to go. And insurance reimbursement changes every time there's a renewal. We actually have been able to negotiate between the clinic and our company a list of services and what they're going to be charged. And then I get an invoice on a monthly basis. I sign the invoice, and within 2 weeks, that invoice is paid and sent back to the clinic. So they're getting a direct bill, and it's pre-approved rates, and it increases their cash flow, and it also helps me budget better for expenditures from my safety department. What more will you learn at the seminar that will help your business? You can learn how the partnership with a clinic can provide you with an immediate reduction in the frequency and severity of workers' comp costs. For instance, it's highly unknown by clinics and providers that if an employee comes to see the doctor on a Friday and he can come back to work on Monday, that starts the days counting on a lost time. And for instance, a lost time injury, if somebody is away from work, costs 3 times what an injury does if they come back to work right away. So how to calculate that and how to understand that is just a piece of the puzzle that's very important when you're trying to market to other companies. How will the seminar help my company make money? One of the most controllable costs to any company is their workers' comp insurance. There are quite a few calculations that go into determining what the workers' comp premium will be. The rates are typically set by a state or a workers' compensation bureau, and then the mod rating or an experience modifier is used to add to or subtract from that actual premium, and we will talk a lot about those calculations, how to reduce lost time injuries now, and to how to build a great safety program going forward, and how it kind of snowballs. You start real slow, and as you start seeing success, you think of other ideas that you build in and into the partnership with the provider, and pretty soon you've got a pretty well-oiled machine that's working well for the employee, for the employer, and for the provider. How will the seminar help my company make more money? When I started, as I said, I had about 100 employees, and I paid about $1.5 million for workers' comp insurance. There were no rebates. We were in a captive insurance program, and every dollar that we spent stayed with the insurance. Now we've been able to get traditional insurance, reduced the first year we went to traditional insurance, we reduced our insurance cost $600,000. And now we get up to a 40% rebate depending on what our loss runs are at. So it can mean literally hundreds of thousands of dollars for your company to be able to reduce those workers' comp claims and the cost of them. So why would you choose a partner? Why would you choose one over the other medical provider options? One of the things that we found early on was that if our employee was injured and they typically went to the ER, they could sit for hours in the hospital waiting room, and once they were done, the hospital could not do the drug testing, so they'd call us, we would go and pick up the employee and take them to another facility to get their drug and alcohol testing. It was very convoluted and it was very time consuming, and we were searching for better medical services for our employees. And in the end, those better medical services actually cost us less. There's improved relationships. There's more personal, tailored services to the needs of our company. We use a provider that understands our company, what our work is, and what types of injuries our employees are most apt to be exposed to, and we're able to test for that on the pre-employment or the post-offer, and to have the provider help us redesign that work so that we can reduce the number of injuries. The biggest thing for me when someone goes to an ER or even to a clinic that you're not a partner with is the employee gets a sheet that says return to work or you have to stay home, but the employer doesn't get a phone call right away. And with our partnership, I get immediate communication. Before that employee leaves the office, I get a phone call and they tell me what the injury is, what they expect the recovery time to be, what kind of work the employee can do, and then they send the employee back to me so that we can make sure that we've got a program put together for that employee that helps them heal and gets them back into work as soon as possible. And there's always that ability to understand each other's business. We had taken our management staff out to the clinic, and they got to see all the services that they provide. Even though we didn't use all of those services, they began to learn and ask questions on why don't we do this or can we add that. And we bring the doctors on site so that they can see the work, and it makes a much better working relationship. You can picture what kind of tests are going to be done, you can picture what kind of services can be offered, and you can begin to add services as needed. It gives you a big whiteboard to make suggestions on. So what value-added services will we learn about? Post-offer testing, fit for duty, drug and alcohol testing, DOT physicals. We use our providers a lot for help with the job descriptions, worksite reviews. Anytime, one of our policies is anytime someone says the word ouch, injury, I might have hurt myself, they get assessed immediately. That way there's not that possibility of getting up the next morning and can't get out of bed because it should have been iced or ibuprofen or something done the day before. Post-incident services, functional capacity evaluations, and we recently just added wellness within the last couple of years, and this year we're adding health coaching and smoking cessation. So we continue to add and use the revenue that we used to spend on, or the dollars we used to spend on workman's comp insurance, and use that more in a preventive way to help our employees. Mary, this is back to you.
All right. Thank you, Carol. Appreciate it. And we have a few questions. So if our attendees online have questions, please use the chat in the bottom of your screen and send the chat to me, and I'd be happy to bring your question up before Carol. But before we do that, I am going to introduce to you Mary Meyer. And you heard from Carol and how she got started. And Mary Meyer, why don't you tell them a little bit of your story, because yours is a little bit different from Carol's, and I think it'll help someone to understand who you are and what you're doing up there in beautiful Montana.
Great. I am a registered clinical exercise physiologist, and I have a health and wellness facility in Bozeman, Montana. I was approached by a company who had numerous injuries and issues, and they were facing a mod rate of 1.99, probably not being able to pursue private insurance anymore, huge financial costs going into their injury rates, and they basically said, well, what do we do? What can we do? So at that point in time, it was basically an approach of, okay, how can I help them stop the bleeding? So I actually pursued the seminar with JTECH and Brad and Mary and Carol, and kind of looked into that program.
Mary?
What we implemented. Yes?
Mary?
Yes?
I'm being asked by one of the attendees to either turn up your microphone or speak a little louder.
Okay. I'll turn up the
Sorry.
mic. How is that?
Okay. Is that any better? A little more.
Okay.
All right, better.
Okay, perfect.
Sorry, didn't mean to interrupt you.
That's okay. So what we implemented for the company was, after a job analysis, we started doing post offers on their new hires, because we felt that was the best way to initiate bringing a better quality candidate in for the job and to help with the injury rates. So we initiated that in 2012 was the first full year of the post offers for this particular company. We did an average of about 200 for the year. And at the end of 2012, going through the numbers, we significantly brought their total cost of their premiums down from $268,000 from 2011 down to $100,000 for 2012. Significant decrease in injuries. They were finding a better employee, less lost time, lost wages paid out. Matter of fact, it pretty much eliminated those down to a few $1,000s a year versus the prior year they paid about $78,000 in lost time wages. Productivity was better, a lot less injury rates. So in a sense, it was starting at the hiring process. And then this next year, we are actually pursuing more of their current employees and offering injury prevention programs and wellness programs. So it's a real great way to generate some different dollars, but actually be very effective in helping a company reduce significant costs.
Thanks, Mary. One of the differences between what Carol started with and what Mary started with, for those of you who are interested, is that Carol had this plan to do post-offer screenings, or drug testing was her start. And Mary Meyer's employer, he just needed to, as I call it, and you've seen me refer to this in some of the materials, is to stop the bleeding. And so they began just with post-offer screening. So some of the questions that are being asked right now are really good, so I'm going to get to those. And let's do this. Carol, why don't you give us your answer, and then Mary, if you have anything to add, please do. All right.
Sounds good.
So the first question, I'm going to do this backwards here, but I'm being asked, what is the typical reimbursement for a post-offer employment application or employment screen? So this is for the clinic. Mary, what are you actually charging or getting reimbursed? And I know this doesn't involve insurance, so we're not talking about your bills getting cut. So when you tell them what you bill for a post-offer, Mary, and tell them what you get paid.
Okay. Basically, it depends on the amount of the post office you're doing per company. But right now, we charge $175 per post offer. And like I said, it's because we have such a high frequency and we have the complete access to all the post offers for this particular company.
Okay, and I have some information from the clinic that Carol Jamrose is partnering with up in Green Bay, Wisconsin, and his rate for post offers for the clinic, for those of you who are interested, it runs between $200 and $250, and it depends on the job, because if the job is very simple, the post offer is not going to be as elaborate, and it also depends on how much that employer is doing with him. So as you can well imagine, all of Carol's services are done through this clinic, so she gets a better rate on all of her services than anyone else does. So if that helps you. Now, I did ask him for a little more information, so Mary, you might want to chime in after I give these statistics and tell us what you're seeing. And keep in mind the post offer is going to vary on the job description and what's needing to be tested, but Dr. Brad up in Green Bay tells me that in the post offer, he spends the first 10 minutes with the employee doing the physical and selecting which tests need to be done in his JTECH testing system. The next 30 minutes is with the staff member, and they just basically run through the testing that he has selected, dependent on his physical exam and the job description. And the last 10 minutes is spent by him doing the report. He says that the total doctor time is 20 minutes, and he can do the whole thing if he's doing it himself in about 30 minutes, but sometimes it takes the staff longer to do their portion. Just depends on how well trained they are. So, Mary, what are you seeing in time of you doing post offers?
Generally, the first 5 or 10 minutes are just reviewing medical history, finding out past issues and situations, and obviously adjusting the test as needed. And then our full program, our full testing is usually 30 minutes, and that's just giving adequate time to give proper instruction. If the candidate is struggling a little bit with the testing or that type of thing, it just allows enough time and a little bit of break time, and then that way it gives me some kind of breathing room to evaluate as I'm going and to see if there's something else I want to test or if I want to retest that particular area if I didn't feel it was an accurate test. So overall, a complete post-offer for us is about 45 minutes as well.
Okay. I have a question, and it says, what do you charge for a fit for duty? I don't know, Mary, if you've done a fit for duty yet, but I have a sample report on a fit for duty that Carol's provider did. I do not know what he charged for it, but again, the one that I have the example of is a real person who wasn't injured at work, was actually injured working at their home and couldn't return to their job, so that's why it was a fit for duty. And I'm happy to send those report examples to everyone who's attending today, and then we can ask him what he may be charged for that kind of post offer, and maybe if he remembers how long it took. So I'll get that back to everyone. Another question is, what do they test for in the post offer testing? And that really depends on the job. So Carol? Mary, do you want to, each of you maybe take a second and answer that one?
I'll start. What we did when we started implementing the post-offer functional capacity was go back 5 years, look at our loss runs, and determine what part of the body, what severity. You know, we just did some statistical analysis on our loss runs at each individual claim and determined that we saw knee and shoulder, low back. Those were the 3 injury areas that we saw. So we really wanted to be able to test those. Well, we implemented some other improvements along that same time, and we really have eliminated back injuries at this point. So we actually changed the protocol, but that is how we went about it. We looked at the loss runs and did some statistical analysis on what do we need to test, and then we built the test or the protocol for the test based on injuries that we expect.
Okay. Mary, do you have anything to add to that?
Basically, I did the same thing, but I actually went out in the field with the individual to examine what they do throughout their day and then reevaluated the job description and then designed the test off of that.
Okay. And have you done any fit for duty, Mary?
No, to be honest with you, we haven't even pursued that just because of I'm looking actually for more staff to kind of help out. So, but I do have with the university here, I know they do a fit for duty and they get a reimbursable rate of $150 per fit for duty test.
Okay. One question is, what are the dollar differences between the original work comp premium and the dollars being spent now using your current provider. Is that something that we touched on earlier, or Carol?
Yeah, I had 100 employees. Yep, I had 100 employees, and my workman's comp was 1.5 million. Now I have 300 employees, and my insurance is about 424,000.
Mary, do you have any stats on Pete's business?
You know what? We are actually meeting in less than 2 weeks to review all of that, because obviously, you know, as with the mod rate, it's a 3-year turnaround. But I believe there's going to be some significant reimbursement because of the huge amount of change in a year. So I don't have anything updated as of right now.
All right, but what you had given me was actually out in the invitation that we sent to everyone. If you're familiar with the invitation that you originally received from us, there was some statistics in there, and one of them was they saw a reduction of $170,000 in their work comp premiums 1 year after testing started. That statistic is from Mary Meyer, who is on with us today. And then the 36 injuries were on employees who were not post-offer tested, and of those 36, 18 employees had to be put on light duty, and they had substantial time off work. 10 injuries were on employees who were post-offer tested. 2 of the 10 had minor injuries, and 8 were returned to full duty. So that helps everybody kind of understand that. Let me go look at another couple of questions here. Okay, and this one is there a general standard of protocols? I understand each company is different, but most job specs should be relatively similar, such as forklift driver. Is there a basic standard of protocols? Carol? Mary? Carol probably has more information on...
A significant number of our employees are forklift operators. We have a warehousing division and a transportation division, so we split between forklift drivers and drivers. The protocol for a forklift driver is different than for a truck driver, and the protocol for a warehouse forklift operator compared to one that was maybe servicing a line in a facility, there's so much more time on the forklift. Our guys work 12-hour shifts, so we saw some injuries that were more from repetitive and continuously being on the forklift than injuries from getting on and off the forklift, which is what you see more in the production end of it. So our protocol was more set to what types of injuries have we seen in the past and what do we want to prevent going forward. Obviously we want to prevent them all, but every year we review those to make sure that our protocol meets what we're expecting or where we're expecting to see issues. So the protocols are not quite the same, but they're very similar.
And in the JTECH software, for those of you who haven't seen it or may not be familiar with this portion of it, once you design a protocol for a particular job, you store that protocol to use over and over and over again with other employees who are in that same position. So Carol's provider in his JTECH system with his post-offer, he'll have a post-offer called forklift driver. And if there's different ones, it might be forklift driver A, B, or C. But once he designs those, then he saves them. When someone else comes back in, it doesn't matter. They get the same test and in the same order, so that there can be no discrepancies between the way you did the testing for one individual or one applicant over the other. And the same is true in the return to work as well. One more question. Ballpark dollars being spent with Carol's provider now for her current preventive care program.
You know, I don't think I don't think I have that number off the top of my head.
But we could get that information to everyone after this is over with. The other one probably will have to wait as well, and that question is basically what kind of revenue is your partner clinic generating from the services offered to your company, RGL. And I'm sure Brad will be able to, provide us with a little bit of that, I don't see a problem with that.
Yeah, he can probably provide with both numbers. I'll look them up on mine as well. At least one of them.
Okay, I got a last question here. How do you test endurance factor for sitting for 12 hours? And I'm talking specifically about preset. Okay, I can answer that question offline in terms of the JTECH software and the JTECH system. And then is there a list of such as hand grip 50 pounds for each position? So I can answer those as we get in later. So I'm not seeing any other questions, and we have run to the end of our estimated 30-minute time. So I'm going to let you go for now, and if you have any questions, what you want to do is call your regional manager. The number's on your screen. And you want to basically register for the Salt Lake City seminar. Carol's going to be teaching in detail. And if anyone has any questions, just email your regional manager or call us. We'd be happy to answer questions. And the questions that we couldn't answer today, we will get that information out to each of you. So thank you very much for attending. Carol and Mary Meyer, both of you, thank you so much. And have a great day to everyone. Have a good weekend.
Bye. Thank you for letting me share.
Bye, everyone. Good luck.